So, ladies and gentlemen, may I request all of you to please welcome our guests for this particular plenary. This plenary will be moderated by Dr. Anupam Sibal, member CII Healthcare Council and Group Medical Director at Apollo Hospitals Enterprise Limited. We will be joined by Mr. Darpan Jain, Joint Secretary at the Ministry of Commerce and Industry, Mr. Ashish Bhatia, Business Head at Fortis Healthcare Private Limited, and Dr. Dharminder Nagar, Managing Director at Paras Hospitals.
Good afternoon. I'd like to thank CII for this opportunity. As we all know that the Government of India has launched two very important projects, Heal in India and Heal by India. We know that we are the third largest pharmaceutical manufacturer in the world, 60% of vaccines, 40% of generics in the US, 25% of all medicines in the UK are made in India. And clearly there's an opportunity to produce more medicines, consumables, equipment, and that is one component of Heal by India. But the other area which I think is receiving a lot of interest is human resource development. We have a demographic dividend that is really going to work well for us. Projections till 2100, so for the next 80 years we're going to have something like 800 million workforce. While the world is going to age, our working population is going to be stable at 80 crores. And estimates from WHO suggest that there's going to be a shortage of 15 million healthcare workers in the next decade. And India, with its young population, has the ability to produce not just enough human resources for India, but for the globe, and 1 million health human resources a year can be produced. The government in the last few years taken a lot of initiatives. We've got the NMC, we've got the Allied Healthcare Bill, we've got the Nursing Bill. The number of medical MBBS seats have gone up from 45,000 to 90,000. So clearly a lot of traction in that area. And then the other initiative is Heal in India. And we've seen that India has become important in terms of medical value travel, but our current position is still 10 out of 46. And there's no reason why with the support that the government is now providing, the different ministries coming together, and the value proposition that India has with excellent quality, competitive cost, is very attractive. So one would hope that in the next few years we go up in the rankings and achieve 1 or 2 or 3. And all of us are very excited about the prospect of seeing more and more patients come in. We've in India treated patients from more than 170 countries. And I think in the coming few years we should see more volumes, and we should do more and more complicated work because we have the ability to do high-end procedures that very few countries can. And we also have the advantage of holistic care, and we have the advantage of Ayush. And this mix or amalgamation of the best of East and West, no other country can offer. And I think wellness needs to be included as part of our offering in terms of medical value travel. So to discuss these two areas under the title of globalization, we have a stellar panel, and it's a privilege for me to introduce our panelists. We have Mr. Darpan Jain. He's 2001 IAS batch from the Karnataka cadre. He's done his MTech from IIT, also has a master's from the London School of Economics, and was conferred with the Honorable Prime Minister's Award for Excellence in Administration for the year 2011-12 for the initiative Saving Open Spaces and Urban Lakes, Soul and Cultural Rejuvenation. So thank you so much. Darpanji is now the Joint Secretary overseeing this initiative in the Ministry of Commerce. Welcome. And to my left is Mr. Ashish Bhatia. Very interesting career, lots of experience, 4 decades from T Estates to Hero to then at Fortis now for more than 2 decades. So thank you so much for being with us, Ashish. And then our third panelist who's on his way here is Dr. Dharminder Nagar, who's a doctor by training and has an MPhil from BITS and has done an executive MBA from Harvard, and has been working on creating a network of hospitals across level 2 cities through Paras Healthcare. So I'm going to invite Darpanji for his opening remarks, please.
So, Anupamji, thank you so much, and thanks CII for inviting me to this summit. And I have very few slides just to structure my speech. Already Anupamji has summarized the entire issue, I think, so well. He has touched upon important facets of health services. I'll focus on the international trade in health services, and in my work in Department of Commerce, I handle international trade in services. So all services trade which India is having with other countries, it could be in health services, education services, IT services, audiovisual services. So I look at that. So health is part of that. So I'll just start with the first slide, which kind of gives a state of play. What is the position of international trade in health services? The market is quite big. It's almost 100 billion US dollars. When you see this 60 to 100 billion US dollars, you might ask, this is a very big kind of a variation. This approximation is not quite okay. And the reason for this is that the data capturing which is happening on health services, on medical value travel, so data is not very robust. In fact, this is one of the important point which I would make subsequently also, that we need to have a very strong data capturing as far as the health services trade is concerned. So, but of course, there is a data on how many people are coming from other countries to your country, or how many people are traveling internationally for availing health services. The number before pandemic, this is a number which is before pandemic, pre-pandemic number, because during pandemic you are all aware that travel was restricted. So it had touched a number of around 11 million, and in India we have seen number go up to around 3.5 lakhs. So if you take that as a basis for estimating our share in the global market of medical value travel, it is around 3 to 4%. And when we look at which are the countries from where we are getting most of our patients, most of the people who are receiving our health services, so it is focused mainly on travelers from neighboring countries. And when I say neighboring, the predominant country from which we are getting patients is Bangladesh. Then we also have people traveling from West Asia. We have people from Iraq. We have people from other West Asian countries. We have a lot of patients coming from Africa. Then we have patients coming from CIS countries. So this predominantly covers our, I would say, 95%, more than 95% of people who are coming from different countries. This is the source. Now, there are other countries in which patients are traveling, and there are a number of competitive geographies also. Korea is emerging as a good competitor. Turkey of late has emerged as a very strong competitor in offering medical value travel services. Singapore has been a strong player in health services. Thailand is again a very strong country as far as providing end-to-end facilitation in health services is concerned. So this is how the global market is. And as Anupamji was pointing out, in terms of professionals who are available to give these services, when you look at the labor projections of different countries, you will find that there is going to be a big shortage in the category of healthcare professionals. So there is going to be a labor shortage in most of the categories of work, but in case of health services, it is going to be very, very predominant. If you look at projections of Canada, if you look at projections of US, if you look at projections of UK, so you take any developed country, they are going to have major shortfall in availability of professionals who can give health services. So this is again another big area for us, as we were discussing, the demographic dividend which India enjoys. the labor force which India has. So this is again another important area for us. The fourth important point, which is again transforming the way health services are going to be delivered, is the emergence of digital health, the digitalization of delivery of health services. And this has got accelerated during COVID time. The number of consultations which happened, I think in eSanjeevani we had almost 7 million consultations. And I don't think in last 20 years we had so many consultations. So in 1 year, this kind of transformation has happened, and it has happened in most of the countries. A lot of countries are now having their own tele-consultation framework, and this is an important area as when domestically this kind of a consultation can happen. Can it be happen also across the border? Can we also make it happen across the border? So this is another important area, I think, which is an important area of focus. Now, in light of this, what Department of Commerce is doing? So Department of Commerce is one of the players from the government side in this overall health services exports policy framework, if you want to call it like that. So we have Ministry of External Affairs, we have Ministry of Home Affairs, we have Ministry of Health and Family Welfare. So all of us partner together to ensure that we are able to export more and more of health services. What Department of Commerce in its domain is trying to do, we negotiate a lot of free trade agreements. Now, what is there in these trade agreements? We try to ensure that our workers, health workers, get an opportunity to work in other countries, countries with which we are engaging in free trade agreement. So I was telling you about labor shortages in some of the countries. So can our workers be facilitated in going to these countries and provide their services? Can they provide their services online, if possible? So for that, again, we are seeking mobility, ease of mobility for these workers. We are seeking market access. So market access would mean there is a health service provider who is there in that country who is providing services. So we should be treated on par. There should not be any discrimination against a health service provider from India. So this is the kind of access, this is the kind of non-discriminatory treatment which we are trying to lock in the free trade agreement. So in future, if our health worker wants to go, if our health establishment wants to provide a service, they can provide service. And in a trade agreement, just to tell you, there are 4 modes of supplying service. In a service agreement, there are 4 modes, and all 4 are relevant for actually health services. What is mode 1? Mode 1 is basically cross-border supply of services, which is your digital health services. So if I am doing a telemedicine consultation across the border, it would qualify as mode 1 services. What is mode 2? Mode 2 is a person, the service recipient is traveling to another country to receive service, which is nothing but your medical value travel. Mode 3, I establish commercial presence in the other country and I deliver service. So if my hospital establishes a presence in another country and delivers services through that, that is mode 3. Mode 4 is if my service supplier moves and then gives service, like my nurse or my doctor is traveling to another country. So all the 4 modes are very important in delivery of health services. So all these modes are covered. Another area on which Department of Commerce is focusing is promotion of health services. So we are engaged in number of programs which try to ensure that our service suppliers meet with the prospective service recipients in other countries. So this is another area. Fourth area, at a multilateral level also, at WTO, we had a ministerial in WTO recently. In that, an important point which we made was that in response to pandemic which happened, there needs to be global capacity to deliver health services. And this global capacity to deliver health services can happen if countries come together and create a pool of resources. The pool of resources could be in form of health professionals. The pool of resources could be in form of digital applications. So this is something which we are trying to push at the multilateral level. And the last one is again the facilitation part. If a patient has to come from other countries, can we facilitate in the visa process? If there is a need for establishment of presence here, can we do some facilitation? So these are some of the steps which Department of Commerce is undertaking in areas under its control. Now, this is the last thing which I would like to show, and this basically shows the important areas in which future steps can be, I would say, categorized. The first one, as I was saying, the digital health mode is an area on which we need to focus. A lot of countries have sensitivity in allowing professionals from our country to travel to their country. They may not allow easily. But if you are providing services remotely, like our IT services, a lot of our IT services are being provided remotely. If we are able to provide services remotely, and with the way technology is developing, with the way IoT is developing, artificial intelligence is developing, so I think there is a lot of potential in this space. The way we have telemedicine framework within our territory, we should have a telemedicine framework across the border and try and deliver services across the border as much as possible. I think this is a very important potential area. Second is establishment of high quality infrastructure, developing more of, I would say, Medicities kind of framework in which holistic health services can be delivered to the people who come. It could combine our health services, allopathic services, Ayurvedic services. So holistic services, if we can give through provision of high quality infrastructure, I think this is an important area. Third is focus on insurance G2G arrangements also. A lot of patients who are coming from other countries, they are being sponsored by their insurance companies. They are being sponsored by their governments. So can we look for such arrangements in which the patients can travel, sponsored by their government, sponsored by their insurance companies? This is an area on which we need to work more. The next area is end-to-end facilitation. The Heal in India campaign is something which focuses on right from the time the patient starts looking at which are the health establishments, to filing of visa application, to traveling, to coming to this country, and then dealing with all the procedural requirements. Can we ensure end-to-end facilitation so that patients find it very easy to come? Fifth point, again, promotion has to be very focused. So we need to shortlist countries where we think we can make difference, where we need to resolve issues which are being faced, and we are able to achieve tangible outcomes in a short time frame. The sixth one is a very, very important thing. So when we were discussing once we had a discussion with all the ambassadors of different countries on what their feedback was on our health services. So many of them pointed out that we don't find that there is transparency in the way your health establishments are charging. Health establishments, they say something, they charge something else, the rates change. There is no one place from where we can get transparent idea about what is the charge for which category of service. There are different categories of facilitators who are there. Many of them narrated their incidents of getting defrauded on account of treatment. So a lot of those experiences, they narrated to us when we were having discussions with them. So I think there is a need for developing a system which is high quality, which has recognized players in the system. We don't have fly-by-night operators, because even 10%, 20% of such incidents, they spoil the entire brand of our health services. So we need to focus on that. And lastly, which I was mentioning in the beginning, high quality data is very important. All of us talk about evidence-based policy making, but evidence-based policy making will not happen unless and until I come to know how many coming from which country, which kind of treatment they are taking, which place they are going to, what they are spending, and then how much I am exporting on digital health, how much I am able to export my services through establishing presence abroad. So I think on all these items, we need to collect data. And maybe industry can itself come together and maybe annually come out with data, high quality data on the kind of health services which are being rendered. So I will stop here. These were just some points in a structured manner for further discussion. So thank you so much.
Thank you very much, Darpanji. Very comprehensive, and you touched on all the important areas that keep coming up in what might be holding us back and what needs to be the driver or drivers to help us achieve that number one position. I'm going to now request Ashish ji for his remarks, please.
Thanks, Anupam. So very quickly, I'll just talk about globalization a little bit. Globalization has become the buzzword and in economies across the world. And it describes how nations, economies, people, healthcare, amongst other things, sort of integrate and become interdependent over a period of time. And falling trade barriers, mobility of capital, mobility of labor, mobility of information, all of this has helped globalization in a very large manner. I'll take a step back and you look at the pandemic. I think from a healthcare perspective, it was the epitome as far as globalization was concerned. The fear of the unknown, as in the pandemic, brought countries together. There was great transparency. Every mode of treatment that was tried anywhere was shared immediately and others could follow. From an Indian perspective, you look at it, we heard the gentleman from Bharat Biotech, the fact that we were able to manufacture our own vaccine and also collaborate with AstraZeneca for the Covishield vaccine. And we ended up exporting 140 million doses across the world. We exported HCQ, we were exporting medicines across the world. So all of this has led to a great amount of globalization. Now, one of the major things in globalization is the fact that peace and harmony are a given. And if you look at it, subsequently the Ukraine war has led to sanctions and other things. This comes in the way of globalization. Now, when you talk of globalization and India, I think the first thing that comes to our mind is travel, the medical tourism, that comes into our country. And Mr. Jain has, expanded on it and how those numbers are increasing. Over the next 6 years, it is anticipated that those numbers would go up a lot. And then there is, of course, this whole concept about trained professionals from India. As somebody mentioned, ours is a very young population. We are known for the talent that we have, and therefore the government is looking in terms of, how do we train these personnel and send them abroad. And needless to say that it would generate employment, it would bring in foreign exchange. But the fact of the matter is that, truthfully, as a country, we are already facing a major shortage, as far as nurses and doctors are concerned. Probably, the metros don't face it as much, but smaller towns, tier 2 cities, it's becoming even more difficult to be able to bring in nurses. I've been in healthcare for over 21 years, and I find that, last year or early this year was one of the first times that we actually shut down certain areas of the hospital for lack of adequate nurses. So now the challenge is going to be that how do we, fulfill a requirement which the world has, and as part of globalization, people have the freedom to be able to travel, go all over the world to be able to work, and how do we be able to retain what we require from our country's perspective. So I think those were a few of the things that I, wanted to just touch upon in my opening comment.
Thank you, Ashish ji. This is one session where the organizers have been very generous in giving us time for Q&A by having fewer panelists. So if you have 6 panelists, there's no time for Q&A, but we have time here. So if anyone has any questions, any suggestions, do identify yourself, keep your question brief, and if it's a comment, then super brief. Please.
Hello.
Please go ahead. Yeah.
Myself Kapil Parashar from Vyom Group, and we are running a challenge startup mantra with Invest India and Ministry of Information Technology for last 3 months, and we have received more than 300 applications for startups, not from India, abroad also. So the major issue of our startups is the timely funding. Because the time is the most precious thing for the startups. If the funding is coming after, this is a question for the Jain sir, that it's a very big demand that everybody is looking for funding, but funding is not an issue. The timing of the funding is a very big issue for the startup. And the second question is that we are just running an integrated incubation center and running a short-term courses for the nurses and the, you can say, digital tracking ventilators and other equipments training providers for India, and the facilitators from the devices provided by the various countries and Indian. So we want to be a member of like Fortis and Apollo for these short-time courses in the tier 2 cities we are opening in the integrated incubation center. Thank you very much.
So this is what happens when you have senior IS officer, nothing to do with globalization. So I'll leave it to you if you want to answer that question. But
Yeah, so no, on the startup side, my general, I mean, from the data, my impression is that there is no funding issue. And timely funding also, I don't see, I mean, the way startups are growing, I mean, you would look at the number, the way number of startups are growing. So there is a steady growth and the number of unicorns also which have emerged. So I think in terms of the money which is coming into startups, the angel investors who are coming in, the different sources of finances which have come. So I think the menu of options are also growing, and I think it will further grow in future. So I think startups who have a very good idea, who are able to convince the finances, are able to secure funding. So, but there could be some individual cases in which it may not have happened. So.
Ashish, you want to talk about the training courses and
Yeah, so I think the training part of it, I think, would be most welcome, and I think we should look at how we can collaborate, because even we are looking at ways on how to train our people, and make them more productive. Thank you.
Yeah.
please.
Yeah. Yeah, my question about the medical tourism. ये actually question मैंने 15 days पहले CI के hospital tech conference हुआ था दिल्ली में, वहाँ पे पूछा था, लेकिन I don't have a proper speaker to answer, but sir, you have there. My question is there कि भाई, as I'm connected with the 20 countries, and many times a foreigner comes here, they ask me about, earlier they asked me which hotel I have to stay, but now they have aggregated portal. But still they have find out about the hospitals. Still we have to book them. So is there any possibility where government can establish the facility center over there in other country, where, where always tourists come here for the medical tourism actually, patient. Either government started, or there are also tourist agency over there who we can train them about, about the wellness advisor actually. They are aware about our ecosystems. So they rightly advise over there actually. So it is very much needed over there. They not problem for the money. Example, country like Oman, Bangladesh, US, UK. So I want to know your future, or either government start, or they can outsource the people actually who are willing to for the public service, for their view about not for the making money, but something, systemically way, sustainable way, how we can design faster way where G20 is coming, so we can take the leadership about this medical tourism. Thank you, sir.
So I can answer it in two parts. So one is the facilitation part. So this entire Heal in India campaign is actually going to provide all information in one place. So which are the hospitals, which are the doctors, what kind of treatments are available, what are the charges, which are the places you can stay, how do you come, when do you come, how do you book appointments. So I think the informational gap which at present exists, so to a very large extent that informational gap would go away once the Heal in India portal is fully functional. So that is one thing. Second, we are also taking up with our missions which are located abroad. So we have missions which are there in most of the countries. So through those missions, we can popularize this portal, and also the missions can provide added support in terms of answering queries of prospective patients or people who want to consult. Third, could be also individual hospitals can also have their own facilitation setup apart from this. So maybe like Apollo is having its own help desk or some kind of a facilitation arrangement in a country where they see a lot of potential. So that is also a possibility, I think, on which private hospitals can work.
Thank you. Thank you.
Thank you so much, sir. I'm Dr. Kavar from Key Healthcare. My question to Mr. Darpan Jain is, it's a couple of questions, sir. The first is, the concern is the visa, sir. Our foreigners, the patients, they are not getting the visa on time. So that's why, when they took too much time, they moved to some other countries. So they are not, prefer to travel to India because of the lengthy process. Second, the security of foreigners. When the patient is admitted in the hospital, any hospitals, when they come out, they stole the money. Can we introduce the medical preloaded currency card or something like, from the government of India, where the patient can deposit the money and then take the e-card or something like. The third one is, if you will see on the airport, there are many unethical people are there who stole the patient, to talk in the local languages. It happens, sir. It happens. And, when the patient pay to that, it's a bad impact of India, So I'm talking about unprofessional or unethical people. Thank you so much.
No, so I completely agree with your points, and in fact I also made reference to that all these unethical practices, they should stop. And one is hospitals and facilitators themselves should try and ensure that unethical among them are not recognized. Like, let me give an example. No hospital should accept a patient brought by a facilitator who is not a professional. That can be done. Does not require government. See what happens if a government puts in any regulation, then it leads to again affecting ease of doing business. So it is a double-edged sword. We can ensure that all facilitators must be licensed. Tomorrow that regulation can come. But if that regulation comes, then you will say you are asking for license for everything. So maybe it may happen in future, but the best course of action could be that the industry itself is self-regulating in a nature that it discourages unethical practices. So that is, and in fact, government is encouraging that. The Heal in India portal only recognizes hospitals which are accredited, which are recognized, only recognizes facilitators who are accredited. So they will not have any facilitator who is not pre-certified. So there would be only hospitals and facilitators who are certified, so that anyone who is coming from outside is able to take services from them only. That is first thing. Second thing, on the visa part, our effort is to reduce the time for processing of visa, to ensure that they don't face any problem. But there are certain countries which are countries of concern, and I can't elaborate more here. So from those countries, checks have to be very, very rigorous, because the question of national security cannot be compromised. With that in mind, we have to work, but we have to think of creative ways in which how we can further streamline that process, so that we are able to get business also without compromising the national security aspect.
Thank you so much, Darpanji. In fact, in the last 1 year or so, we've seen so much traction, so much movement. And I think with this, it's nice to have a name to the program. And now with these two programs, Heal in India, Heal by India, both of which are going to be run in a mission mode, we are going to see a lot more movement than we have in the past, please. And then you.
Hi, this is Dr. Mamta Jain, CEO of Shri Agrasen International Hospital, 500 bedded. So my question regarding this medical tourism, one is like the regulations, because many come as a facilitator, they become the student over here and then become the drug peddler, we all know. So there should be some way in and out strongly. Number two is why we are looking at the medical tourism just limited to the corporate hospital or the private players, why not at the government level? Or some kind of regulation on the standardization of the medical tourism.
No, I think we discussed that point on some kind of a mandatory regulation from government side to the way regulation, the self-regulation is happening in especially the facilitation area. Health establishments in any case are regulated under different laws. But if, I mean, industry feels that there is a need for more regulation, I would suggest that let industry do that consultation. We would also engage on that, and maybe we can have a look at it. If more regulation can result in better outcomes, I mean, one can really give it a
Yeah,
try.
Very briefly, because we
it's
have to move
irony,
to
sir.
the next. I think we're going to do this later because you've had 3 questions. Yeah.
Just one more question, because we allow that $10,000 can be carried as a cash money, but in India we cannot take the patients, foreign patient or Indian patients, 1,99,000. Is there any regulatory, if patient comes from abroad, he can give something in cash?
No, so cash, we don't encourage cash, so you are aware. So I don't think, so as a policy decision, government does not encourage transactions in cash. Government wants more and more digital money to be used.
Thank you. I am Dr. Shahi, Uday Shahi. I am from Banaras Hindu University. I am a doctor. And I see what during your deliberations, government institutions are really kept excluded from all these discussions. Maybe one has to work to strengthen the work facility and the strength available in the institution, in the government institutions, and to make use of them for achieving this goal for healthy India. So, what are you doing there? Because you see, in government institutions, what is the problem? There are certain rules and regulations, and they are really not able to come out to provide these facilities to a great extent. So maybe someone or some institutions who can talk with the government hospitals and institutions to make them more, or rather more capable of developing themselves into such centers to provide this help.
So
This is number one, sir.
Okay, this is a rather long one, so the next one has to be really brief.
Okay,
Yeah.
then. And the other thing, now I imagine if a doctor, if a hospital, if an institution wants to convert themselves into this digital healthcare provider, is there any institution, any group which helps in this transformation, and how can this be done?
So I think Darpanji, you have already represented Ministry of Commerce, Health, Tourism, Home, External Affairs. So now you also have to double up again as Home and Human Resources and try and answer the question about government hospitals.
No, so I think, as I was saying, there is a lot of demand for health services in our country itself. So we should not look only from private versus public lens. We need to develop high quality infrastructure, high quality services in the country. If we are able to do that, and if we are able to have a very focused promotion program, we would be able to achieve good results in medical value travel. But the need is developing more and more high quality infrastructure, more and more high quality services. So that should be the aim, and government is doing it. You would have seen so many hospitals and medical colleges which have got opened in last few years. I mean, there is a steep rise in the number of colleges which have come. Almost every district is now having a medical college of its own. The number of professionals who are getting trained is increasing every day. So, but it takes time. It takes time to scale up, but we should move in that direction. We should move in a direction in which we can have the world-class health infrastructure, world-class health professionals. If we have that, we would be able to provide treatment to the entire world. And we have the workforce for that. We have the human resources for that.
Exactly.
Thank you so much, Darpanji. I think we're going to have to, the organizers are telling me to wind up. So we're going to have to go. Yeah.
So really, how can we strengthen these government institutions?
Well, I think, let me answer that. Okay. There is a lot that's happened in terms of strengthening government institutions. I'll give you 2-3 data points. India had 340 medical colleges. We have 629 in 8 years. We used to produce 45,000 MBBS doctors. We produce 91,000. Going up to 100,000 in the next 2 years. 22 AIMS will be commissioned by February.
Agree, these are numbers, but
Yeah,
quality,
these are strengthening. So
quality.
I think, yeah. So it starts with a plan. It starts with implementation. It starts with follow-up. As Darpanji said, it takes time. It takes 9 years to produce a specialist. It takes 13 years to produce a specialist. So it's going to take time. Thank you so much, Darpanji. You've answered questions across the board, and normally that doesn't happen, so we're most grateful. And this, I can clearly see the CII team smiling. They will invite you in every conference now because you're just so magnanimous. Thank you so much, Ashish, for your comments, and thank you so much for everyone who asked questions. This was a truly interactive session. Thanks ever so much, and over to you, Akanksha.
Thank you. Thank you so much, Dr. Sibber. Thank you, Mr. Jain. Thank you, Mr. Bhatia.